Welcome back everyone to the another session of the Phacoemulsification. So this case again going with the topical anesthesia, the side port and the main port done, and as the pupillary dilatation was less, so injecting the adrenaline, now filling up the anterior chamber with the visco. The video is in the 2x, so you can slow down if you want, and then without touching the conjunctiva, going for the rhexis. No air diversion done as usual, fixing the globe with the forceps in the side port. Now the half of the rhexis is done, and then inflating the AC as the OPD was leaking. The rhexis is almost completed. Now going for the hydro dissection, deflating the anterior chamber first, so that there will be any snap of the posterior capsule. Going to the equator of the lens and then injecting the hydro. Now inflating the anterior chamber with OPD again, and then with the help of a dialer, I will be dialing the nucleus. Now going for the direct chop with the chopper. The air bubble was there, so I had to come out to remove that. Initial pre-phaco removing the cortex, and then going deep and going to the equator with the chopper, and then direct chop. Again holding the nucleus and chop. Trying to take out the one quadrant or one small piece. So once you can achieve that, once you take out one small quadrant, then the taking out the remaining nucleus would be easy. Little shakes with the phaco probe would dislodge the nuclear component from the tip of the phaco probe, and simultaneously stabilizing the globe with the dialer. As it is being done under topical anesthesia, so in some cases where the patient is non-cooperative, the fixing the globe is paramount in such cases. Now the small pieces of the nucleus. I'm taking out whatever was left, and that's it. Now going for IA with the coaxial. As in earlier video also I have told that the coaxial is comparatively I have found better compared to the bimanual. So all of you must practice the use of the coaxial if it is available in your institute. Quite easy. The most difficult part of the subincisional cortex taking out is the most difficult. Apart from that, it's very easy. If you have this thing in your institute, you must practice that. Once you are done with the cortex, you can change the mode to the polish. For polishing the posterior capsule, that would give definitely 6 vision. Inflating the bag with OVD, and now injecting the IOL. In the earlier video, I have shown that I was trying to do the hydro implant. I had some issues with the hydro implant, so now again switched to the OVD. And once I am being comfortable with the hydro implant, I will be trying that. But for time being, I am staying with the OVD for implant only. Once the IOL in the back, now going for the visco removal. 2 minutes of the visco removal. The some visco removals part I have removed from this video to reduce the duration. So that's all, your case is done.